We've been providing trauma care at Northeast Georgia Medical Center for a lot of years. We've had the competencies and certainly the surgeons that have the capabilities, but what we lacked were the processes and the systems that really create a trauma program.
Many people felt we were a trauma center, and our professional staff said, well, we certainly provide a high level of service, but we don't have the credentials that would allow us to say we are one. And that really became the launching point for establishing an effort to answer those questions.
Not only were we looking at the data, but we were hearing from the community. Why are they driving past you? Why are they flying over us? We were able to evaluate what the risks were of doing it and of not doing it. And that gave us the resolve that it was time to take it on because it was the right thing to do for the community.
You're in Northeast Georgia and you have heart problems. Where do you want to come? You may have other hospitals that do good in cardiac services, but it's proven here. Now we have the trauma, and now we want to make the trauma the same thing, that if you unfortunately experience a traumatic injury, this is where you need to come to.
And when you look at where we've excelled with stroke care and with cardiac care, cancer, for instance, it's the same feeling. It's the same passion that comes from everywhere from the EMS providers, nursing, physicians, administration, board members. That same swelling of support that was required to build those same programs is going to occur and has occurred with trauma.
When I first arrived in Gainesville, even during the interviewing process, I was very surprised. It was sort of like this secret in the mountains. Incredible staff. They had a supportive administration. They had top-notch resources, and there was a very big need in the community. But what they didn't have was a leader that could put all of that together and make it work.
So we have a director of trauma services, and then followed that with a medical director for trauma services. So we've really elevated our capabilities through technical skills. As a matter of fact, we now have 5 fellowship trained trauma surgeons on the medical staff, and we're recruiting for our 6th.
And if you look at the 13 county service area that we provide care to and for, we're the go-to. And we take that mission very seriously, and we feel it is our responsibility to provide the appropriate level of care. We look well beyond Hall County in any of the services that we provide. We do feel that responsibility throughout the entire region. Our motto is being better tomorrow than we are today at everything that we do. And trauma is no exception to that. It's all about standardizing. How can you improve the processes? How can you improve the care? And it is, it's never ending. It is never ending.
Well, this matters because all of us drive on 985 and 85. And, you know, we've got a lot of hunters who go out and get hurt in the woods. And we have little kids who fall off their skateboards. And all these things are trauma. And trauma is any kind of accident, any kind of injury. And so that happens to any of us, and trauma is something that is unexpected. We don't plan our accidents, they just happen. And we need to have something immediately available to give us the care that we need when we need it, and to have the right care at the right place at the right time is what we're all about.
I have a broken neck. My airbags didn't go off, so that caused me to have multiple internal injuries, and I was bleeding out. You know, I was told that probably another 15 minutes and I wouldn't have made it. I was actually driving home from work, and a deer ran out in front of me. I didn't swerve, I just slammed on my brakes, but I had like an anti-lock brake failure. So one wheel locked up, the other one didn't, and there was just nothing I could do. It just threw me off the road, into the woods, end over end. I woke up about 30 minutes later, called 911. Finally, an ambulance got there, but I was well within, because I know trauma, the golden hour. Time was ticking, and as soon as I got here, it was fantastic. I've never seen anybody work so quickly and so efficiently to save somebody's life. I got to tell you, I mean, I was in the ER. I was getting CT scans, X-rays. All my blood work was done. You know, Dr. Adamski and the rest of the trauma team had me ready to go to surgery. It felt like within minutes. I wouldn't be here if it wasn't for that. I can guarantee you that. Between God, Dr. Adamski, the ER staff, yeah, that's the only reason I'm still here.
Back in August, I arrived at the hospital via ambulance, and I was unconscious. And that night, I had lost 7 units of blood, which is enough to kill most people. Because of the blood loss, I had lower abdominal gangrene. I spent a week in an induced coma. I was in ICU, I believe, over a month. And for the first 2 months I was in the hospital, I had a total of 13 surgeries. I was in the hospital a total of 3 months, almost to the day. I firmly believe that had it not been for Dr. Adamski's skills as a surgeon and his surgical team and everybody's skills at this hospital, there's absolutely no way I would have lived had I went to another hospital other than any other trauma center, which from my house would have been too far away, basically. I probably wouldn't even have survived an ambulance ride to Atlanta.
Northeast Georgia Medical Center's designation as a Level 2 trauma center is a monumental accomplishment, not just for the people of Northeast Georgia, but for the entire state. The hospital fills an important gap in the statewide trauma care network, working to ensure that Georgia residents are never far from a designated trauma center.
We're now able to provide complete trauma care here, so almost nothing should have to be transferred from Gainesville to any other trauma center at this point.
Air medical is still going to be an important part in this area and utilized in the proper fashion, but they're going to have a lot shorter transport times of bringing them here versus flying over and going on to Atlanta.
People kind of equate trauma with what they see on TV, and it's the emergency department. But it's much more than that. Trauma is absolutely a continuum of care. So injury prevention is part, but EMS, huge aspect, absolute necessity on our team. They bring us our patients. The ER obviously is another important player, but if we're doing our job really well, it's very short term for that patient. And not every trauma patient needs to go to the operating room, but you're in the OR, you're in the intensive care unit, where you go after that. Our surgical floors are a huge part of our team. That's where our patients will stay, sometimes for a long period of time, as they're recuperating, as we're developing their discharge plan. What happens to the trauma patient once they leave the hospital? Some of these patients have devastating injuries and they need rehab. So again, our rehab center is a huge component. We want to get these people as functional as they can, back to work, back to school, back to being a productive member of society. So we need that whole team to do that.
We know this actually across the nation on large-scale studies, that we can decrease the risk of injury and the risk of death and dying from an injury by 25% by coming to a trauma center. Trauma can happen to anyone. It doesn't discriminate. And trauma care itself is a lot bigger than designation. It's a public service, and Northeast Georgia Medical Center is doing the right thing for our community, the right thing for our region, and the right thing for our state.
For us, it wasn't so much about designation, but again, when we put it in terms of patient-centric, we knew that whether we had the sign or not, we were going to do the best that we can as an organization for patients that had the disease of trauma.
Providing trauma services is really mission-driven for this organization. Obviously, we have to have fiscal responsibility, but this is a service that we felt was necessary for this community.
It was one of those projects that required perseverance, and there were ups and there were downs. There were times that we were not quite sure were we going to get through this next hurdle, but we did, and we've come out on the other side in a very positive, strong way.
Since this is my hometown hospital, I'm especially proud that Northeast Georgia Medical Center has achieved designation as a Level 2 center, denoting a natural progression for this innovative health system that has continually sought opportunities to better serve its regional community. Congratulations to everyone involved, and keep up the good work.